Now, for those of you who are watching at home, I just ask that you get comfortable, get us some tea, get not your coffee, we'll talk about that later. If you're up north, get a little hot toddy because it's probably snowing up there, and just kind of sit back, take in this discussion that we're going to have about the health and well-being of our community, the Black community. So just to kind of orient you on how things are going to go today. So we'll do a discussion, and then we'll give you, towards the end, we'll give you about 10 minutes for questions and answers. So if you have some questions that we don't cover that you would like for us to address, make sure you type them in the chat. And then in that 10-minute period, we'll get around to answering your questions specifically. In the meantime, again, I want to thank the panelists, and I also want to give them an opportunity to introduce themselves. So we'll start with some introductions, and then we'll get into our discussion. So I'm going to start with Gina, who is at my top left on the screen. So Gina, could you please go ahead and introduce yourself?
Yes, thank you for inviting me, Nicole. Just to give a little bit of background, Nicole and I go back a long time. We both went to the University of Florida, and she, of course, reached out and asked if I would do this, and I said absolutely. I'm here in Jacksonville, North Carolina. I am a licensed clinical mental health counselor, so I deal with people from all backgrounds. And I think it's important that we have this platform so that people are aware and have good information. So I want to thank you for, having me on the panel.
Thank you, Gina. And then I have next, Ebere.
Hi, you guys. I'm Ebere Sonoiki, and I'm here in the San Francisco Bay Area. I met Nicole. Has it been maybe about a month, 2 months ago? And we were on a live Zoom discussing just how we were coping as moms during this COVID time. But my background is in infectious diseases. I have my PhD from UC Berkeley. School of Public Health, and my emphasis was on infectious diseases and immunology. And so I'm excited to be here and I've just been interested in watching this COVID and just really being able to, even though I'm not working hands-on on it, just kind of being able to follow and try to understand what it's doing. And so I'm excited to share a little bit of what I know.
Thank you, Ebere. Okay, and next I have Carol.
Hi, thank you, Nicole, for arranging this panel and to address a really important issue. Carol Oladele, my background's in public health. I'm an epidemiologist, a social epidemiologist, and a lot of my work focuses on health disparities related to cardiovascular disease and nutritional and other social determinants of cardiovascular disparities. So I'm happy to be here today and contribute my knowledge on health disparities and related to COVID. Thanks.
All right. Thank you, Carol. And then Ben.
Hello, everyone. Thank you, Nicole, for organizing this. I'm Benjamin Renelus. I am a physician, currently wrapping up my last year of gastroenterology fellowship training here in Brooklyn, New York. I'm excited to tell you guys what I've been seeing on the front lines and contribute to the discussion.
All right. And then last but not least, thank you, Ben. And last but not least, Kevin.
Yeah, this is Kevin Washington. I'm excited about this conversation. Sad that we have to have this conversation in this particular manner. However, it gives us a chance to really unmask some things that I've been dealing with for a number of years. I'm a licensed psychologist looking at the dynamics of racism and how it impacts mental as well as physical health. And so Nicole and I go way back, every bit of about 2 or 3 days, but that's cool though, because this is how it works. This is how family comes together, because the person that connected us, actually, she and I go back to the Bay Area and beyond, because her father is one of my jegnas and our mentors, Dr. Wade Nobles, who has informed us about the impact of course, what it means to centralize or localize ourselves within an African construct of mental health and well-being. So I'm currently the head of sociology and psychology at Grambling State University, but I'm in the DC area because this is also where, this is actually my spiritual home, where I grew up when I was doing a lot of work and understanding who I am as a Black man in America. So I am excited about having this discourse with Ben and Gina and Dr. Oladele. Am I hitting you?
Close.
Oh, okay. There it is.
Okay.
Oladele. I got you. Ola. I know what we're talking about. And our dear sister, pronounce the last name for me.
Sonoiki.
Sonoiki. Gower got you. And so it is exciting to have this conversation, to be a part of this discourse to elevate our people. Thank you.
Okay, thank you. So just so we all get an idea, as we're going through, so why are we here? Why are we having this conversation? So one of the things that I was looking at when before we got into the pandemic, and it was in Italy, and I was reading how doctors in Italy were having to decide who to save. And I thought, man, if this makes its way to the States, this is going to be really bad for Black people if it comes down to a decision. And so as the data started rolling out, we see that the African-American communities are some of the ones that are most hardest hit. And so this is just a graphic that was taken from CNN, and it looks at the percentage that Black people make in the population, and then the percentage of deaths due to the coronavirus. And so you can see in some cases, it's double our representation in the population, almost triple in some cases, the representation in the population. And now, just in general, I read that COVID-19 has now become the second leading cause of death in the US, only second to heart disease, which is number one. So this is an important conversation for us. And this is just kind of the launching pad for this conversation, but it really goes beyond that. The mayor in Louisville, Kentucky, he said something, and he said it well, so I figured I'd just quote him. He said, as we've all seen so often, it's our under-resourced and minority populations that tend to be the most at risk and face excessive and unfair disadvantages in any crisis. So maybe you're not so worried about the coronavirus, okay? But no matter what crisis there is, we tend to be the bearers of the brunt of it. So if we look at Hurricane Katrina, if we look at the HIV/AIDS epidemic, if we look at when there's a recession or depression, if we look at environmental distress, if we look at the existing health disparities, we tend to get the brunt. So it goes beyond just what's happening now. This is a good point for us to start this conversation, but it really does go beyond that. He also goes on to say that even before, so this gives us an idea, even before COVID-19, there was more than a 12 years difference in life expectancy between some neighborhoods. So someone in a particular neighborhood might live to age 80, okay? Whereas someone in a different neighborhood, in that same age range, is gonna live to 68. Because of the things that plague our city, our nation, the institutions. And as he said, this is unacceptable, which is why we're here to talk about it. So here are some of the topics that we have of discussion, and I'll give you a chance to kind of look over those, but ranging from some of the chronic illnesses and diseases that are prevalent in our communities, how that ties into the coronavirus and COVID-19, some of the mental health implications, the impact of racism, institutional, environmental, systemic racism, and then what we can do to protect ourselves, what we can do as a community in order to lessen the trauma and improve our outcomes. As I spoke before, here's our agenda. And then, so let's go ahead and kind of get into the questions. So the first question, all right, here we go. So the first question deals with when we first started hearing about the coronavirus, and we were hearing about how it mostly impacted the elderly. And then we started hearing about how there were people that may not be elderly, but had certain conditions that were being impacted severely if they were infected. So for awareness purposes, could you please kind of speak to some of the illnesses and diseases that make a coronavirus infection more severe, and what that looks like in the Black community? And so I'll go to Ebere first on that.
Awesome, thanks, Nicole. And I think as many of you have heard, I mean, a lot of the reasons why we're seeing the disparities show up in the way they are is because African Americans are also just have a very we're heavily represented in some of these areas, some of these diseases. And so you guys have heard this over and over again, and we talk about like high blood pressure. And I'm glad that we have Dr. Ben on the panel to also shed light into what they're seeing on ground. But we have high blood pressure, we have diabetes, we have, diabetes is, anyways, I'm not gonna go into the very details of it. And then we have, of course, a lot of it also is tied to obesity. I think the key here is the comorbidities that are being talked about right now are things that are being seen. A lot of things I've heard people ask is, well, how can you link high blood pressure or obesity or diabetes to all of these different things? And these is, especially with COVID, I feel like the scientific community is still doing a lot of work to kind of tease out the specific links and how they cross over. But there are general understandings of how these things kind of end up making different disease situations worse than they are. And so immune compromised patients, especially when you're dealing with cancers, and that's why like the elderly are more susceptible because their immune systems are not as strong. We've played and talked about asthma generally, and that's just based on a hypothesis or just kind of like an expectation that patients with asthma might be more severely impacted. But we were talking about that just a little earlier, that some data, and when we talk about data in this context, you guys have to understand too that like the things are just changing every day. And we can't necessarily make very absolute conclusions about a lot of things scientifically, just because a lot of what we are going to be able to talk about now are just observations. And those observations might change depending on geography or depending on all of those different things that come in and play a part. So based on New York's preliminary data, asthma is not really ranking high on their list of some of the things they're seeing in the patients that have died as a result of COVID. But those are some of the ones that I'm sure everyone has heard of, and I'll let Ben and Carol add to it.
Okay, thank you. Carol, you want to step in?
Sure, thanks, Ebere. So I just want to conditions that she just spoke about. Blacks have higher prevalence of conditions such as obesity, hypertension, diabetes, and it's likely that the higher prevalence of these conditions is what's contributing to the disproportionate infection rate among Blacks. Also wanted to note that, having uncontrolled diabetes, uncontrolled hypertension likely exacerbates the severity of your infection, the infection as well. And I think that this pandemic just basically has illuminated disparities that have been persistent over years that, Many of us and other health disparities researchers have been tackling these issues and trying to get at root causes, but they've existed. This pandemic has sort of illuminated the fact that, Black and brown people in America have disproportionate burden from these conditions.
Thank you, Carol. And then Ben, do you have anything you'd like to add?
Yeah, I mean, just to piggyback on what's been stated, cardiovascular disease, immunocompromised status such as diabetes, chronic obstructive pulmonary disease, also known as COPD, these all play a burden on morbidity and severity of multiple illness, including pneumonia, including ARDS, which is acute respiratory distress syndrome, which is what we're kind of seeing with those with severe COVID-19 infections. So as far as not necessarily the transmissibility, but the severity and the morbidity once you have COVID-19, your body is under a lot of stress. And if you have limited reserve based off of your baseline conditions, you'll have to, go through a longer hospital course, and your body will have to fight more in order to treat and control the infection. So.
Okay, thank you. Now, I personally have struggled with high blood pressure on and off since 2015. So for someone like me who has one of these chronic illnesses, what are some lifestyle changes that you may suggest for us in order to be a more healthy people or delay the onset or mitigate some of these chronic illnesses? And I'm going to go back to you, Ben, on that one.
Absolutely. One of the things that we know that treats hypertension is really weight loss. So for every 2 pounds of weight that you lose, your systolic blood pressure will go down by 1. So whenever we see patients with hypertension, the first thing we try to address is lifestyle modifications. So we want you to exercise at least 5 days a week, 40 minutes a day if you can. We want you to have a diet that's well balanced and low in salt. Now, whenever we say a low salt diet, what does that mean? Some studies or some doctors will recommend an aggressive, less than 2 grams of salt a day. That's pretty aggressive, but you want to be at least less than 4 grams of salt a day. And particularly among African Americans, we tend to retain salt, which is good for if you're an outside slave, for example, to retain salt in water. However, that will also increase your risk of blood pressure. That's why certain medications that treat blood pressure are effective in Blacks, such as your diuretics, because it's addressing the salt absorption. So first off, lifestyle modifications, diet and exercise, weight reduction. Second, with diet. Third, with medications and being compliant with the medications.
Okay, all right, thank you. Now, for me, I believe some of my blood pressure was triggered by the stress of losing both of my parents within a year's time, starting a new job, and starting a doctoral program. And then it persisted due to some bad habits that I had. What are the contributions of mental health to the acquisition of chronic diseases and illness in the Black community? And Gina, I'm gonna go to you for this one.
Okay.
There you go, Gina.
All right, you can hear me. I'm sorry, could you repeat the question again, Nicole?
So the question talks about the contributions of mental health to the acquisition of chronic illnesses and diseases in the Black community.
Well, I think we have to look at it from a historical perspective, because there's a lot of stigma associated with mental health, and that starts with education and letting people know that if a person has a mental health diagnosis, mental illness, and we have, once again, going back to the historical part of it, a lot of times in the old days, people would say, oh, this person has spells, or, you know, they have, oh, that's just their way. They would say certain things like that. But a lot of times that's a diagnosis. That person maybe has bipolar disorder, or they're having psychotic features, or whatever the case may be. And instead of, you know, stigmatizing, we need to educate and go seek help. You know, just like now, if a person with the COVID-19, if a person were to be coughing or exhibiting any of the symptoms that have been listed, you're going to go seek help for them. And we need to do the same thing when it comes to mental health as well, because that's part of us, and it's about having a balance with the mind, body, and soul.
Yep. Okay, absolutely. And Kevin, what would you like to add to that about the contributions of mental health to chronic disease?
So it's important to recognize the connection between racism, oppression, and how the body functions. I think oftentimes we can deal with or address the anatomical phenomena that takes place. However, there's a connection between the psychological aspect of how we function and the body. So I submit that racism is the greatest health threat to Black people in America, and I would even dare say globally. But when we talk about racism, then what does racism do? It is a psychological process by which we try to handle or address something that we cannot find some level of control for. So as a result, we know then that cortisol level increases. We know that the issue of adrenaline increases. And when that happens, we're talking then about the body trying to function under a state of fight or flight on a continuum. It's one thing to have fight or flight when you have a known adversary, right? You have a problem, you're trying to escape from a dog chasing you. But when that cycle is operating on a continuum, it is not turning off. There is not a moment where there is rest. And then we know that adrenaline has to be burned off within the system, or else it just sits there. So we're always operating at this high level of flight and fight. And then almost anything sets us off. And so we know then that the body desires simple sugars, and sugars then are ways for the extremities to get energy. And when that energy is increased, then we can engage in the behaviors that we want to engage in, which is fight. But the problem is that when we ingest a plethora of sugars, as a result, we end up with other health anomalies, right? And so we have to deal with the issue of obesity, have to deal with the adrenaline system being overworked, and so now we have the diabetes and so forth and so on. So some of these things are so related to racism and oppression that we have to be able to link the idea of the mind and the body to talk about not only the causality of the phenomena, but also how we're going to begin to treat the phenomena. And lastly, what I will add to this is that if we examine all of the major even preventable diseases that exist in this country, we will find that from the various forms of female cancers, uterine, ovarian, male prostate, so forth, and there we can chart a map from New York all the way through to Texas, and we find that there's a higher occurrence of these particular diseases among people where they're Black and brown people. And so in reality, then we're looking at a situation by which the COVID-19 or the coronavirus is simply magnifying a phenomenon that has been existing within these communities for a number of years. And what's critical to note is that most of these link right back up into a psychological piece. Now, how are you going to tell me to go shelter in place when I have to be able to go out and to earn? How are you going to tell me that I'm the least desirable person to be around, but yet now at this moment I am essential to someone's existence? So the point is that I'm thrust into this position to try to work the lowliest occupations to earn the least amount and to contend with the greatest amount of psychological distresses. And now I think we have the magnification of the issue of ill health within the community.
Yeah, absolutely, Kevin. And you've kind of propelled us forward into some of the things, because I was just going to say, before Black Twitter comes and tries to annihilate me, I wanted to call out that these disproportionate health outcomes are not necessarily because of personal bad choices. And so let's go ahead and talk about that. Kevin's already started the conversation, but let's talk more about how environmental, institutional, and structural racism contribute to poor health outcomes. Carol, I'm going to throw that over to you, and then Ebere, if you can add on as well.
So thank you, Nicole. So we know that institutional and structural racism influences the distribution of resources and opportunities in our country, right? And so it disproportionately, it disadvantages Blacks. And so what the result is inequalities in access to resources, all types of resources, and exposure to what we call adverse social determinants of health. So unhealthy food environments, living in substandard or unhealthy housing that has lead in it or has some other noxious exposure. Poverty, living in a crime-ridden community, poor access to education, and inequitable healthcare. We've seen many studies that show that, for example, Blacks are less likely to have their pain controlled when hospitalized. They're less likely to get intensive procedures compared to their white counterparts. And so the institutional and structural racism also contributes to this, leads to these inequalities, that leads to Blacks in this country being disproportionately exposed to these adverse social determinants of health, which we know are so closely linked to a lot of the conditions that we're talking about: obesity, hypertension, diabetes. And so, I think someone mentioned, or maybe we talked before, but racism that influences policies that affect the mass incarceration of Black people in this country. That's another example. Employment policies that are in place that lead to employment discrimination, housing discrimination. And so, Black and brown people in America end up being disproportionately exposed to these adverse conditions that impact their health and result in ill health.
Absolutely. Okay, and Ebere?
Yeah, those are great points for sure. I think if we break it down and look at environmental racism, for example, right? Here's the statistics for some of you guys. Like an estimated 70% of the country's contaminated waste sites are located near low-income housing. Now, what does that mean? If you look at the socioeconomic status and the distribution based on race in the United States, you realize that African Americans are disproportionately represented there. And so that lends us to a lot of these different neighborhoods and communities. There's apparently an 85-mile long stretch that's known as the Cancer Alley, going from Baton Rouge to New Orleans, and it has 150 plants and refineries, right? And most of the communities in these areas are communities of color, right? And when you look at institutional and structural racism, for example, I have the privilege of working with a lot of small business owners, specifically businesses that are being founded by entrepreneurs of color or women. And in February, I did just kind of try to go back in history and do a snapshot, because what we do is, trying to make sure that they have access to business capital. And then when you look at institutionally and structurally, how the African-American community has constantly been at a disadvantage, going back to slavery, right? And you had Abraham Lincoln, for example, promised 40 acres of land to each freedman's family, and that never took place after he was assassinated. And what happened was a bank was set up, and was the African-American community was made to believe that this bank was run by African-Americans and for African-Americans. And so a whole bunch of business folks put their money in this bank. 10 years later, that bank went bankrupt. Nobody got, there was no repercussions. Now, if you think about what this does generationally, when you're looking at generational wealth, right? It's kind of like when someone keeps trying to get up and you keep knocking them down. And that's why even when we have like the Great Depression, for example, and you look at the data and you see that African-Americans, yes, everybody was equally impacted, but African-Americans were not able to rebound as fast as a lot of the other groups, for example, right? So when you look at these institutional type setups and settings, you have there's the Black Wall Street in Tulsa that was burnt down way back when, right? Imagine the number and the amount of resources that went into all of these different things, and all of a sudden then they no longer are in existence. And so all of these different things, and like what Kevin was saying, I think it all links back to this chronic stress. It's like he was saying, it's okay to we all get stressed, that's not a problem. But when you're constantly psychologically and subconsciously, sometimes the stress has become such a part of the way you process life, you don't even understand and know that it's there, right? It becomes a part of kind of like a way that you think. And so data has shown over and over and over and over again, chronic stress is linked to a lot of diseases. And that's why we're seeing that African Americans are disproportionately represented in all of these diseases, because when you're dealing with this amount of stress and you're producing all of these stress hormones, cortisol, and all of these things that are not supposed to be consistently high in your system, now it's changing everything else. It's changing your emotion, it's changing. There's just, so it's so complex and so intertwined, which is kind of like, I like what Kevin was saying about this. Like it all comes back to why we have all of these disproportionate representations in these diseases. And so it's time that we really stop paying attention to how we can move and provide solutions to these things.
Mm-hmm. Absolutely. Now, so let's talk a little bit about what we can do, because we named it. So we have something that we say in education: name it and tame it, because we need to be able to name it before we can actually tame it and address it. So, on a personal note, my primary care physician is Black. My gynecologist is Black. My optometrist is Black. And I specifically look for Black doctors because I know about the data out there that talks about the disparity in treatment. And I want someone that can see the humanity in me. Now, I want to say that, and I also want to say that, not saying that a doctor that is not Black can't do that, but this is something that I did for myself, because when my doctors look at me, they say, that could be my sister, that could be my daughter, that could be my wife, that could be one of my best friends, and they want to give me the best care possible. I've had my doctors call me personally when I moved to Dubai to give me the results of my biopsy. He called me himself, not his secretary. When I wasn't taking my high blood pressure and I came in for a visit and my blood pressure was high, my doctor literally turned to me, he said, "What you praying for?" Like he was my dad, And so that kind of confidence and trust that's part of the steps that I take in order to ensure a better quality of care for myself. But in you guys' opinion and from your experiences, how would you advise Black people to navigate and manage institutional racism to avoid negative outcomes and to receive better quality medical treatment? And then I'll start with Ben on this one. What advice would you have in that realm?
Thank you, Nicole. Honestly, the things that you are doing is what I would recommend: to be diligent and aggressive with identifying your practitioners to who you go to. We know that representation matters, and we know that those people of color are more willing to divulge more information to their practitioner, to their physicians who represent them and looks like them. So I would definitely, first and foremost, if you're requiring healthcare expertise, to seek a physician that has the humanism skills. As we already touched upon, psychosocial stress is one of the top 3 risk factors for cardiovascular disease, and you guys already addressed that. And so to manage someone for their clinical illnesses without addressing the complete picture, including their, the mental health and mind, body, and soul, will be suboptimal for a physician in this day and age.
Thank you. Ebere, do you have anything to add for that, for navigating this institutional racism?
I think when you talk about institutional racism and you think about the direction of the influence, it's coming from outside in, right? Mm-hmm. And I believe that there's a lot of inner power that we all have to cultivate in order to be able to kind of beat this, right? We've lived in a time where, regardless of where you are in the world, right, that Africans or African Americans or Black people in general have always been portrayed as less than historically, right? And so we've kind of bought into this lie though a little bit. And you see that even the way we treat ourselves and the way we treat each other, when people talk about Black on Black crimes or all these different things, but I see that changing, right? I see more of the Black race embracing the beauty of Blackness unapologetically, period. You see that in the hair movement, you see that in the fashion movement, you see that everywhere. And I believe that that's a prerequisite to some of the positive changes that we're going to see long-term. And so I absolutely believe that, one, in order to navigate this, that self-love and self-acceptance is very, very important. The other thing too is, you can either go through life thinking of yourself as a victim, and I understand, like, there's a lot of this stuff that we've talked about already are beyond any of our control. But I also don't like to, once I operate in a victim mentality, I'm no longer empowered to do anything about it. So I think being able to operate psychologically in a place where you know that regardless of the forces against you, around you, that you have what it takes within you to literally rise above it. So cultivate and invest in yourself. Like that for me has been one, that self-love and investing in yourself. And data has shown a lot of times actually that when you look at depression, for example, right? There is no correlation, or there is no positive correlation between income and depression. So meaning that just because you have money doesn't mean that you're not going to be depressed, that it doesn't show. But what shows actually is the more education you have, the less depression. Because guess what? The more education that you have, the more you have essentially enabled or expanded the capacity to process multiple and complex different things and education in different ways. But I say all that to say, like, invest in yourself, cultivate yourself, and self-love, I think, is key, because then that's how you're able to make these decisions that you're talking about, Nicole, about knowing that you can actually choose your own doctor.
Right.
Like, it really takes a level of self-awareness to begin to do that for yourself.
Yes, absolutely. I saw my parents through the last legs of their life. And when I say the importance of choosing your doctors, that really is a life and death decision. Carol, do you have anything you want to add to that?
Sure. All great comments have been made. Just wanted to add 3 things. One, we also have to recognize that the Black community, there's an issue of mistrust with healthcare institutions in the Black community due to the long history of slavery, oppression, and all the experiments that were done within our communities and all the atrocities. So I think the younger generation, encouraging the folks who are older in our family to go, and as you said, paying attention to who you choose. And I think sometimes that, and some data have shown that if someone goes to the doctor and they have a negative experience and they already had some mistrust, they're not going back. Mm-hmm. However, to keep us healthy, we can't just cut it off there. So I'd say for younger folks or folks who realize the importance of being engaged in healthcare, to encourage others in their families and their communities to try someone else. Try someone else who sees you as an individual, treats you as an individual, does not stereotype you based on how you look. And so just, move around, shop around. I mean, it's just like if you're looking for a personal trainer, everybody doesn't fit with everybody. So you find the person that has good rapport with you. And so that's important. And we know that having a good rapport with your clinician, you're more likely to be, patients are more likely to be adherent. And so, and likely to have better health outcomes. The second thing is our workforce. So it's nice to be able to, select a doctor and choose a doctor who's Black or who's a person of color. But the reality is that there are too few of them in the profession for everyone. So I think we need to encourage, and I think someone spoke to this earlier, to raise up a new generation of leaders, encourage our young people to go into these professions so that they're represented. When decisions about policies are being made and we are absent, we end up with policies and decisions that are made that negatively impact us in our community. And so having a seat at the table by being in those, raising up folks who are going to go on to be doctors. I mean, everybody doesn't need to be doctors, but the physician field doesn't even represent the Black population of the US, and so the other piece is advocating for your health, to realize that you have a say in what goes on. You are making joint decisions with your provider, right? And that's how they should be approaching you too. You make these decisions together. And so, asking questions, don't be afraid, don't be silent. Don't take everything that's said, not to discount your doctor's expertise, of course, but ask questions. We're all human. And so realizing that it's a dialogue that you're supposed to have with your provider. And so just remembering that and just advocating for your health. I'm sure you've all read some of the pieces that were published about maternal mortality. I was reading some of the cases, and in some of the cases, if folks didn't, their partners or they themselves, the patients didn't really push and ask questions and demand things, it could have been they may have died. And so just stressing the importance of just advocating for your health and making sure you make a choice to be with a doctor who you can establish rapport with and make joint healthcare decisions.
Right, and this doesn't just say those with lower incomes, because the case with Serena Williams, when she had the blood clot, and they ignored her. So it's not just about income as well. So now, just want to take a quick pause. If those of you out there viewing have any questions, we're going to have a 10-minute Q&A session at the end. Type them in the chat in Facebook, and then we'll make sure we get to those. Okay. So now I'm going to direct the conversation. We're going to talk a little bit about the coronavirus and COVID-19 infection. So my question here is, what are some of the precautionary or preventative measures that seem to be effective in order to prevent a coronavirus infection? And so, Ben, I'm going to go to you first on that one.
Thank you. So coronavirus 19 or novel coronavirus 19, COVID-19 is a infection that can be spread through droplets. So therefore, you want to keep some level of social distancing, similar to what you would do to try to not get the flu, right? Avoid, we say, 6 feet apart, face shields to protect you, ideally N95. If you don't have access to an N95, at least surgical mask or appropriate cloth to protect your nose and mouth. You also want to do frequent hand washings. We don't realize how often we touch our face. I felt like my hands have been on my face throughout the whole webinar, but nonetheless, you want to do aggressive hand washing. Whenever you do hand washing, you want to kind of wash your hand like a surgeon. So the recommendation would be, 2 minutes of, not necessarily 2 minutes, but, prolonged hand washing with soap and water. And if you do have symptoms, you want to minimize, ideally, you want to shelter in place and stay inside your home. So those are some things that we can do on a global level, on a population-based level, to reduce the spread within the community.
Okay, all right. Ebere, do you have anything to add to that?
Nope, I think you covered it all. I would add staying hydrated, of course, is always something good, just in general, to be healthy, practice healthy behaviors and exercising. And we've talked about mental wellness, like pay attention to you in these times, because if you are mentally stressed for whatever different reasons, if that increases, that also kind of puts your immune system at some disadvantage to fight this thing. And I'm seeing a lot of, people have lots of conspiracy theories around where this is coming from, where it's going to, all of that. And I think for me, just the way that I think, I need to see data. And some of these things, I'm not saying that I don't have data to show whether or not they exist, but I'm going to spend my energy and my time on looking into solutions versus trying to dig into something that I really can't address realistically. And so with that said, there is no conspiracy theory from the government to keep you in your home. The people that are coming up with these recommendations are people like you and me that are just trying to do a great job to protect the population. So whatever information that's out there, social media, honestly, please, you guys, just be mindful. And I know that, of course, does it mean that the government has always done things that are in the best interest of everyone? Absolutely not. I'm not saying to not be critical and be very informed about the different things. But all I'm saying is, you know, COVID is infectious, right? But also ignorance is very contagious and fear is very contagious. And we don't need any of that right now. And that's going to help, you know, a long way for you and for your loved ones and everyone around you. So that's what I would add.
You know, the thing that I read is someone says is, you know, that the government or officials have done a good job with controlling the pandemic if people think they overreacted. Because there's only two things you can do. You can overreact or you can underreact.
Exactly.
And underreact is not where we want to be.
Exactly.
So talking about the stay at home and the social distancing measures, there are many who simply can't afford to do that. And this ability to stay at home, again, underscores the existence of privilege and structural racism in our society. What advice would you all give essential workers in protecting themselves? And again, I'm going to go to Ebere and Ben on this.
I'll go ahead and start. So for essential workers, you want to make sure, depending on your area of practice or what your job field. But for me, as an essential worker in the hospital, we demanded we had adequate PPEs. So whenever we're dealing with these patients, that we're also protected and we can limit the spreading the infection to other patients who are vulnerable and to our family members and friends. So if you're part of the essential workers, work group, then you want to ensure that you're protected so that you're not spreading it to more people, and so that you don't catch it and or potentially spread it to more people. Everyone seems frozen. I don't know if it's Mala.
I'm here. I'm good.
All right.
She also mentioned you, Dr. Berry.
Yeah. I think Ben mentioned, pretty much said everything. The different spaces, I think it depends on who you're coming in contact with as well as an essential worker. So a lot of you, like Ben, you're in the hospital setting in New York, where we're seeing high numbers of COVID. And I'm sure the recommendations for you are like very specific and it's protocol. Like this is not like, oh, you should wash your hand. Like there are protocols from many different health professionals when they're walking and stepping into these spaces. Of some hospitals now only have, I think most have like only one entrance, right? Like only one way to get in, and because everything needs to be tracked. And if you're not in touch or in contact with patients or people at close range, then there are also recommendations for those settings. But I think someone was saying this earlier, that's also like a lot of when you go to grocery stores or just all the different settings, you see these things happening. So for me, I think I have friends who are working and they come back, and it's essentially making sure before you touch anything else that you are washing your hands, period. If you're wearing gloves, do not wear gloves outside when, and then wear it into your car. You want to make sure you take, whatever it is, take it off before you touch any other surface. This is not fear. This is just public health common sense. And I think going back to what Nicole was saying, preventative health is hard to appreciate it because you're asking people to move in a way to respond to an infection that might not be, that they don't see. Like it's different when you're telling someone to do something and they're already sick. But when you're saying you might get sick, you need to do X, Y, Z, that tends to kind of not be appreciated as much. But you know what? I'm grateful for the public health recommendations that we have, and I'm also, my prayers are with everyone that's out there in the front line as well.
Okay, thank you both. So we've seen in other disasters and situations, and we're seeing it now, that really we can't necessarily rely on our government or our employers for protection. As members of the Black community, how can we help each other? I know some people have taken it upon themselves to start sewing masks and sending it out to people. So what are some other ways that we can ensure the safety of our loved ones who are essential workers, our elderly, and other members of our community? And I'm just going to throw that out. And I'll start with Gina, if you have anything that you want to recommend. And I'd just like to hear from all of the panelists, things that you think we can do as community members to help our community.
Thank you, Nicole. Well, of course, you're talking about the most vulnerable people in our societies, even more so our small children and our elderly, and of course, people with compromised immune systems and that sort of thing. We have to really look out for them. So, if you know an elder person in your area and they need essential groceries, toilet paper, toiletries, whatever it is that's needed, you're able to do that. You have the proper mask and everything. You can go out and get those things for a person to help them, because we don't want to compromise them if we can avoid that. And also, when all of this first started, I know that a lot of the daycares were still open, and that was very troubling to me, for the simple fact that small children, their immune systems are not built up the way that a full-grown adult is. And of course, when you send a child to daycare, anything that comes up, they're going to bring it home typically, because that's just the nature of children. So just being very diligent and watching out for our children and doing the hand washing and all of that with them, which we should have actually been doing before now, but that is even more so important now, is the hand washing and just being a good steward, and helping people who are vulnerable and people who are depressed. And even if the person doesn't have the resources, even if you have those resources, it's good to be able to give back to other people, and you will be abundantly blessed for that, really helping your fellow man. So those are a few suggestions that I have. Thank you.
Okay, Kevin, you want to chime in?
I want to chime in a long time ago. I've been on fire for quite some time. So it's just been a tough thing.
All right, Kevin.
Not that the words were not eloquent, of that, just they kept sparking. Every genius kept sparking something else within me. I want to be able to address exactly what you said about what is it that we can do. And I'm very appalled by some of the social media pieces that people think are very comical, where I see parents who engage in the process of saying how sick and tired they are of their children. And I think that one of the things that needs to really happen is have a clear discussion around how to be a parent. So I think everybody on this panel have some knowledge and skills that we may be able to enhance the lives of parents. We're giving them some kind of curricular conversations that they can have the children around the sciences, around epidemiology, or around good, sound mental health. I think that we need to do a better job of now finding a wonderful opportunity to re-educate ourselves. I think that it was mentioned earlier about the impact of racism, but we learn a lot of this stuff in schools, right? So the schools then socialize us into seeing ourselves as being less than or inferior. So we have a chance right now to recalibrate ourselves in a most profound way. That is, that we can separate from this system, talk about social distancing, which is real cool, like 6 feet social distancing. We need psychological social distancing from all this madness that has taught us about us being inferior, about us being less than, about us being niggas, about being everything but a child of God, right? So I think that is a very important to think about. I wanted to just share, and I'm not biting the whole mic time. I want to share this, that we must recognize that epigenesis tells us that we have the capacity to inherit, right, the illnesses or the traumas of a previous generation, right? So Resler and Diaz did research around mice, and the mice would have this smell of orange blossom, and they would be shocked. And these mice would begin to be traumatized around the smell of the orange blossom. And then they would have pups, and these pups would grow up and they would have the smell of the orange blossom with no shock at all. And their bodies would respond as if they were being shocked. And then these pups had pups. And so their offspring had the same thing, even though they never were shocked. The issue is that we have to recognize that there is an intergenerational pass down of trauma that we haven't addressed. But what Resler told me about his research, he says that we also have been able to find ways to transmit through epigenesis ways of healing and coping. And so that is sending messages as to how to address the trauma that one has incurred. And I think one of the first things to do is to be able to, first of all, recognize and have an awareness that the phenomena exists. We have a tendency to try to deny the existence of the phenomena. So we think that we're playing the race card. It's not a game, right? See, a card is a game process, right? A game is a game. If one, you agree to play the game, you have a chance of winning the game. You determine what the game will be played. You can influence the rules of the game, but if it doesn't meet those conditions, it's not a game, it's a setup. So we have to recognize then that we're not in a game situation. We're recognizing that there's a phenomenon taking place. Second thing is to engage in racial socialization, teaching our children and ourselves about what it means to be who we are of African descent, right? And not being afraid of that conversation. There's nobody that doesn't tell Serena that he's not Italian, or telling McDougall, whoever, that he's not Irish. But we have a difficult time talking about who we are as a people of profound genius, of profound intellect, strength. And so we have to be able to impart that message, because what we end up with is a message of being niggas, being everything that is inferior. So our songs, our media talks about this over and over and over again, but there's nothing to speak to who we are as a genius. Second thing is to be able to understand that perception, perspective guides perception. That is, that when we have learned to see ourselves as inferior, that no matter what we see about ourselves, we see it as something that speaks to our inferiority. For example, watching Harriet Tubman, the movie, if you see it from a position of strength, a strength-based process, you recognize that there was a woman who conceptualized a way to free herself from the hells of enslavement, and she was able to facilitate that among other people. So we have to understand that when we begin to unpack narratives of who we are as a people, we have to see it from the strength-based perspective, not getting stuck on the inferiority perspective. And then the last thing I would suggest is that engaging in those behaviors that will promote optimal wellness and health. And just because you have a physician that looks like you, I want to be clear about this, doesn't mean that their mindset is still with us, right? So you can be of our color, not of our kind. So the point is that we had clearly a certain general who wanted to jump on behaviors of a population by saying stop drinking and stop so forth and so on, as if it is only those people who look like us, Black and brown people. But when I get on airplanes, the first thing I see a lot of folks get who are not like me, they straight up get in what's it called, Bloody Marys, and it's like, bro, it's like 9 o'clock in the morning. What's going on? So the point is that we have to recognize that because they look like us, that doesn't mean that they're going to talk about health promoting behaviors. We have to do a better job of promoting the dynamics of not only the idea of psychological wellness, but what is that we can ingest? What is it that we can do? The intellectual dietary consumption has to be one that speaks to our power, that leads us to a profound level of peace. And then we can have this element of understanding that we have purpose in the universe. But when we think that we don't have purpose, then that's when we begin to become more ill. So that's what you get for just not asking me to come in a long time ago, because I've been chomping at the bit for a minute.
Get it all out.
It's out. It's done. It's boom. Okay. But we have to engage in the process of understanding that we have a chance to recalibrate, to reboot, and to reconceptualize ourselves in a very profound way. And that has to happen on multiple levels. Absolutely.
I mean, if we come out of this and we're trying to do the same things and be the same people that we were before, then that's such a loss for us. So thank you for bringing that to the forefront. Now, I'm gonna take it back a little bit to the coronavirus, and heaven forbid that any of us or our loved ones actually are infected. But let's talk about what happens or what to do if it happens. So I've heard that treating the symptoms of coronavirus was similar to treating another respiratory illness such as pneumonia or bronchitis. So Ben, is this true? What would you recommend to treat or ease the symptoms? And then I know people have been managing the milder symptoms at home, but when should someone go to the hospital? So if you could talk us through, if I were to get infected with the coronavirus, just kind of talk us through the treatment, what I can do at home, when I should go to the doctor, et cetera.
Sure, absolutely. So most people that become infected with COVID-19 actually have a mild to moderate symptom. So flu-like symptoms, viral syndrome, fever, fatigue, chills, muscle aches. Those are the primarily, the vast majority of symptoms that people have whenever they become infected with COVID-19. So you would manage that similar to how you would manage the flu. So you would take Tylenol for your fevers and aches. You would drink a lot of fluids, drink a lot of water, make sure that you consume a lot of water because your body's at a hypermetabolic state where it's working overtime to kind of make the virus uncomfortable inside your body. So, and most of the time, this viral syndrome will last maybe a week and you'll start getting better. Now, for a subset of people, and what we're kind of seeing in the hospital, so 85% will have these mild to moderate symptoms, 15% will have these severe symptoms. And it kind of takes a turn for the worse around the end of the first week, where instead of just having a viral syndrome, you have this robust inflammatory response, which causes, trouble with oxygen going through your lungs and you become short of breath. So whenever you have profound trouble breathing and not too many people have oxygen saturation monitors at home, but if you just at home and you're having, having to increase work of breathing, you definitely want to be seen by go to the hospital or seen by a physician at that time period. Because the reality is, once you get to that point, you're showing signs that you're going to have a severe course. Now, the targeted medications that has been on the news as far as the hydroxychloroquine and the chloroquine and the zithromycin, these studies were based upon people with mild symptoms early in the disease course. So if you have mild symptoms or if you've been exposed and you start having flu-like symptoms, maybe that would be a window to take the hydroxychloroquine specifically. But once you're in the hospital and once you're sick enough to be in the hospital, from my personal experience, and I'm sure, probably other physicians can co-sign this, we're not seeing a good response of the hydroxychloroquine with patients with severe symptoms. There may be a signal with some immunomodulators and anti-inflammatories drugs for those with severe symptoms, but these are all preliminary and we still need to see the data. And there's been no published randomized controlled trial. I know the New England Journal of Medicine published anti-immunomodulator in, for compassionate use in those with severe disease. However, there was no control group to compare how those people would have done if they just had the standard care. So if you to kind of summarize this, if you have symptoms and you're mild, that may be a window for COVID targeted treatment. If you don't get better with, or throughout the course of you being at home, if you have progressive trouble breathing or progressive shortness of breath, you want to seek medical help.
Okay, perfect. Thank you. And so last question, and then I want to open it up for question and answers. I'm going to look in the panel, look in the Facebook Live and see what the viewers are wondering. The last question goes back to that mental health. Everybody can agree that this is just really a tough time for all of us. And I was telling a girlfriend yesterday, I was like, I don't know how much more I can take. And on top of that, some of us were dealing with trauma before the pandemic. So trauma upon trauma, that's just a recipe for disaster, long-term ill effects in mental and physical health. So I want to go to my mental health people, and I want to ask, what advice do you have for people dealing with trauma from or before the coronavirus, but dealing with trauma right now? Maybe they're dealing with uncertainty, isolation, loss of a loved one, unemployment, abuse, loss of a safe space. What advice and what resources would you share? Gina and Kevin, if you guys can talk to us about that, and then we'll look at some questions from our viewers.
Okay, I'll start us off. Those are certainly excellent points, Nicole. And of course, I have my private practice, and everybody, that's been the hot button issue, of course, is COVID and dealing with it because people feel stir crazy. And one of the main issues that I've been running into is that people are, isolated with their spouse, significant other, children, elderly parents, whatever the case may be, and they're feeling as though they're kind of closed in. Some people are feeling really claustrophobic in their own home because they're outside of their norm, and they're ready to get back to work and that sort of thing. And I've tried to explain to people, I understand that we all want to get back to our quote unquote normal, but the thing about it is we have to do what's necessary to ensure that we can reduce this. And of course, being a therapist, that it's important to have a positive outlet, and having people to come in. But of course, everybody can't make it in to see a therapist, and there is teletherapy available to people. Kevin, he could probably agree with me. I know that with some boards, depending on your state, they've opened it up where people can actually offer teletherapy outside of the state that you're licensed in. They'll issue temporary licenses so that people can have that sort of outlet for them. And another point you made was about domestic violence. There's an uprise in domestic violence because you're with a person, because just because a pandemic happened doesn't mean that violence stops. And if it was happening before, it's even worse now. It's been escalated now. And I did want to share a resource, the National Domestic Violence Hotline number. I would like to share that number with everybody. That is 1-800-799-7233. So that's a safe space for people who are experiencing domestic violence. And I do need to put the caveat out there that domestic violence can happen to men and women. So it's just not a female issue. There's a lot of men who are abused as well. So that cuts across borders, it cuts across socioeconomic statuses, all of that. So we need to be aware of that as well. And also, a lot of people, like I said, are feeling boxed in, closed in, and it's sad to say this, but I believe that there is going to be an uprise in the number of suicides because people feel like they don't have an outlet. There's nowhere to turn to. Resources are limited, and then when we have when people feel like there's scarcity, then they feel like, what is it that I'm going to do? I can't find a way out, so I'm gonna take a way out, so I don't have to deal with any of this anymore. So with that being said, I also wanted to share the number for the National Suicide Prevention Lifeline. That number is 1-800-273-8255. And an easy way to remember that is 1-800-273-TALK if you can't remember the last 4 digits. So those are some things that I wanted to share with everyone. And I hope that it can offer a lifeline and assistance to someone. Thank you.
Thank you so much. Kevin?
So while we're sharing resources, I wanted to bring up the Black Psychologist, also ABSI, has a website with resources. It's also Boris L. Henson Foundation, which is Taraji Henson's foundation, has also come together, gotten some health professionals together to provide services, telehealth, and that they're paying for these services for up to a limited amount of sessions, I think 5 or 6 of the sessions. And so that's a resource for our people. Boris L. Henson Foundation.org is where you would find that. I think that one of the things that we have to recognize is that people are having an opportunity to be as opposed to do. And I submit that that is part of the issues that we find with domestic violence increasing, is because now we have to be together. Oftentimes when we're in a household with someone, we do together, right? We come in, we do, we cook, we eat, we clean, we take the children somewhere, we're doing, but this moment is causing us to have to be together and even to be with ourselves. And so we can spend a lot of time escaping from things, escaping from who we are by doing a variety of things. And sometimes we just do too much. And I think that we're not actually having a moment to be with ourselves, to be at peace, to be in calm, to be able to understand how to silence a lot of the external noise or the external clatter, to begin to understand who we are as a people. So the mental health note is to be able to understand that this is a moment in time that we are being called upon to be and not to do. And that's hard,
Yeah.
right? Because we know how to do stuff. And then the other thing is that talking about, God, I lost it. It was really good. but about Ebere, you triggered that thought for me when you said something earlier. But I wanted to just really allude to the fact that I'm going to submit that a lot of our challenges are because we are being forced in a moment to engage in B. Think about people engaging in the process of holiday season, right? The Passover, Ramadan, or Easter, and to do all those things, but you can't do them with the Easter bunny and the chocolate eggs and all the things. You have to simply stop and be, which is a powerful moment. And we are afraid of that. And I think that's where our greatest healing will come from, is being. Violence has actually decreased in the streets, but increased in our homes. And the question is why? And that is, we have to be able to recalibrate ourselves and to understand that everyone that's in our space is to facilitate us to be better. Even if we've got to get away from them eventually, that means we're still going to be better by getting away from them. But the point is, it's about us to be better people. So that's what I would submit.
All right, thank you so much. So we're going to go to the question and answer portion really quickly, because I know we're over time. This has been really good. Thank you, panelists. You guys have been awesome. The insight that you've provided, your expertise, this has been amazing, better than I could have hoped. And I'm sure that the viewers and the community appreciate it. So one of the questions that I have, and I'm not sure that anyone has this information, is what is the demographic breakdown of essential workers? Does anybody know that information? I don't think we have any data on that right now, but we know in certain cities, it's a lot. I've seen pictures and visuals of people on the public buses, and they're all Black and brown people heading into work in the big urban areas like Detroit, Chicago, but we don't have any hardcore data on that.
It really depends on who you ask also, right? Because the governor, I think Santos, says in Florida that wrestlers are essential workers. So, hey, that's a whole nother conversation about essential workers. But we do know that people who facilitate the livelihood of the betterment of this country, the heartbeat, they are the individuals who are typically the dispossessed, the despised, and the disinherited. And so they largely are Black and brown individuals.
Okay. Now, 2 questions for Dr. Benjamin. It says, can COVID-19 be contracted through the eyes as well due to the small fluid in our eyes? And then that's question number 1. I'll stop there. So I'll let you address that question. And then there's another one for you.
Yes, theoretical transmissibility through the eyes is possible.
Okay, so
I don't know as far as the clinical relevance of it and the ease of transmissibility through the eyes, but it is feasible.
Okay. And then the second question is, what advice do you have for those that live with an essential worker?
Yeah, I should get my wife to kind of tell you guys her list of things. Honestly, just being patient and being supportive and just understanding that, the person that you're with or the person that you're living with, is vital in the life, the heartbeat to keeping society going. So, because they are at risk, you are also at risk. So the same practices that, the essential workers are doing are the same practices that you should be doing, even more so because you're in a close proximity to that person. So washing your hands frequently, keeping the living space that you guys are at very clean, and if they develop symptoms, try to have some level of social distancing, that's fairly appropriate and realistic. So that's the advice that I'll give to them.
Okay. Next question is, how can Americans gauge the trustworthiness of a vaccine? And Ebere, I'll shoot that one out to you because we kind of touched on that. And then the person also asked, if it becomes a necessity to re-enter schools and certain jobs, I'm not sure if they're asking, okay, they're asking that in conjunction of a vaccine.
Yeah.
So the trustworthiness.
Yeah, thanks for asking that question. And this is a question, this is something that I always have to have discussions about. And I understand the fear, I understand the precautions around vaccines, just in terms of people not trusting the entity, government, all of this, pharmaceutical companies. Because whenever you start messing or dealing with any for-profit organization and all of that stuff, you start dealing with the biases that might get into some decisions that are made. Now, with that being said, I have spent years, like I told you guys, my background is in infectious disease and immunology, and I did research on malaria for years, did my postdoc at UCSF, and my research was more in the drug development, vaccine development world. I will tell you this, there is no boogeyman somewhere trying to invent something to put into you in terms of that. Okay, let me rephrase that, because I can't speak to what I don't know. What I can tell you is that based on my experience and what I know, the people that were in my team, the people, and I'm talking international, global, like when you're looking at the teams that are involved in the research that goes behind vaccine development, these are people that care, that want to make an impact. This is based on science, you guys. This is based on, look, I'm a person of faith. And I'm also a person that believes in the impact of science. I believe that we can take advantage of both, right? And so, because a lot of times I get this from, especially from communities of faith, like, why should we don't want to take vaccines? Well, if you go back historically and look at what we were like without vaccines, and because of COVID, we have seen some of these instances come up, and we talk about the Spanish flu, we talk about all these different things, and how you have like 35 million people dead in 18 months, right? These were pre-vaccines, right? And pre a lot of the understanding that we have about public health now. So vaccines, again, because it's in that realm of preventative health, it gets a lot of heat, and there's a lot of all these conspiracy theories, but it's actually based on very, very sound science. And the things that go into a lot of the vaccine compositions have been things that have been researched. And the components are within levels that are very good, that are not like of any health hazards, right? Now, does that mean that people have vaccines, side effects due to vaccines? Absolutely, but the rates are so low that when you compare that to the consequences of not having a vaccine, against some of these different things, for someone like me that's preventative health minded, that's not an alternative. That's not an option that we're willing to entertain. And so, I think I saw someone ask, like, the US seems to be a lot more bent on pushing, vaccines. Well, when you look at data, vaccines have worked. And for me, it's all about, look at the data, show me the numbers, look at the data, and see how we've been able to eradicate some infections from, you talk about polio, you talk about smallpox. These are things now that we read on textbooks. Why? Because we came up with effective vaccines that took care of them, right? And so I think I applaud the scientific community and all of the work that's going towards finding a good vaccine, because not all, different vaccines have different levels of effectiveness, right? And so, but I think that I'm all about it. I'm all for it. And I think it's a good direction, definitely, for us to go.
Okay, thank you. So 2 questions. One's very quick, and then I have to wrap up because our panelists actually have things that they have to do outside of this. So I want to respect their time. But the one question was, someone commented that they have lupus and that they've been taking hydroxychloroquine for years, 30 years. So her question was, well, so I think I'm kind of in the clear as far as it goes with this coronavirus thing. Does she have anything to worry about?
So having lupus places you at a immunocompromised status, just with the systemic autoimmune disease. So there is a risk as far as having a worsened trajectory or clinical course because of the COVID. Interestingly enough, though, and I wish I could cite the papers, we've been seeing a milder response in those that have lupus than what we anticipated. And being on hydroxychloroquine and Plaquenil, I mean, that's good. Hopefully the prices haven't jumped up since it's been popular. So, I mean, that's fine. What was her question with regards to, I guess, having lupus?
Basically, it was am I in the clear since I've already been taking hydroxychloroquine? So
yeah, no, I wouldn't say you're in the clear. No, I would not say that, just because this is my personal bias. This is not from the the CHEST Society of the Society of Pulmonary and Infectious Disease Physicians or anything like that. We look at from what I'm seeing with COVID-19. I see a bimodal clinical course. I see first is like your viral pneumonia type picture, and then there's this aggressive inflammatory response. We call it like a cytokine storm picture. So in the initial viral syndrome picture, yes, taking your Plaquenil, should be effective. But in the second, course of second phase that, 15% of people are experiencing, where they have an aggressive inflammatory response, Plaquenil is not helping. And I said that there's a signal that we're not seeing as severe cases in certain groups that we would anticipate seeing a severe clinical course, and some of the lupus patients were one of them. So that may be isolated to our community, that may be isolated to New York City and the rheumatologists and whatever drugs that they're taking, but she's not in the clear. But at least if she was exposed and she was to have mild symptoms, the hydroxychloroquine would theoretically be a benefit.
Okay, all right. And then the last question from the viewers is for Gina. And the question was, what advice would you give to someone who is depressed because of the stay-at-home orders? And this is a real issue, as a single woman. If it weren't for my girlfriend who I'm staying with right now, I don't know what I would do looking at these four walls for 4 months. I don't know if I would not be in pajamas right now, honestly. So what advice do you give for those who are suffering from depression during this stay-at-home time?
Well, I think one of the best things to do is to be engaged in life. Sure, you're very limited when you're at home, but during that time, there's things you can do. I'm all about, empowerment and people uplifting each other. If you're able to look at some positive programming, let's not do all the Jerry Springer and stuff like that, but let's look at things that are uplifting, something where you can learn something. That book that's been sitting on your shelf for forever, take some time and read that. Good music. I think I shared, I did. I shared on my page, I think it was last week, where I did a huge puzzle. I did a 1,000-piece puzzle, because it's going to have you thinking and using those critical thinking skills. So those are some things you can do. And if you have children, loved ones at home, try a new recipe, but just stay within the confines of your home. I know it's difficult. I'll be the first to admit that it is very difficult, but this is a trial that we're all going through, and we're all just trying to navigate this all together. But those are a few suggestions that I have. Anything that's uplifting. Of course, we have like this platform. We have Zoom. You have Skype. Check in on people. Just sometimes it's good just to hear a voice, because that person's struggling, but other people are struggling as well. And there's actually even people who do online groups because they can't meet, because of the close proximity. But you can join groups where you can actually talk to other people about what's going on with you and express your emotions. And of course, if you have a good confidant that you can depend on and talk to about whatever's going on with you, that helps tremendously. And last thing I would say is journaling. And some people might say, oh, that's kind of cliche, but no, it actually helps, to write down your emotions, because we all have to remember that of course, once again, we're all going through this, and time's gonna pass. We're gonna get through this, be it scathed or unscathed, but we will get through this. And then you'll be able to look back again and say, wow, I survived during that, and you'll have a story to tell to your grandkids one day, because there is light at the end of the tunnel. And I think if we just really need to remember that, and we'll be okay. I don't believe in a bunch of rainbows and sunshine all the time, because that's not life. But the thing is, we will get through it. And there's going to be more deaths. There's going to be a lot of sad times. But if you have a good system in place where you have people that you can talk to and engage in good, positive activities, we'll be okay.
Yeah. And I think you bring us to a good note, is we will get through it, and we will be okay. And so we are thankful for conversations like this. We're thankful for people like you, the panelists, who are willing to share and willing to reach out. And we're just thankful and blessed for our loved ones right now. And I just want to conclude. I'm going to conclude the panelists. Those of you who have to go, feel free to go. I'm going to show the viewer some slides that capture some of the highlights from the discussion. If you have your phone ready and you want to take some pictures of these slides, feel free. And then we're just gonna wrap up. So, Ben wants to say something.
Yeah, I just want to say one thing, because I was just thinking about the last question regarding taking hydroxychloroquine. So first and foremost, I just want everyone that's watching us to know there is no FDA approved treatment for COVID-19. All of these drugs that we're using are experimental, and the benefits are either on a small scale and has not, and we're trying to see if it would be represented on a larger scale, or in certain lab studies as opposed to in human studies. So I just want that to be clear. So there is no treatment. There is a theoretical, cure for COVID as far as COVID-directed treatment. There is a theoretical signal in hydroxychloroquine for those with mild symptoms in a few studies, but this is yet to be determined. So okay. The risk is still present.
Okay. Thank you. Ebere, so you wanted to say something?
Sorry, I wanted to add to Gina, what Gina said as well. Great point, but I think this is a time, going back to what Kevin said, to leverage your faith. And this is scientifically proven that people of faith, and it doesn't matter what faith you have. Of course, I'm a Christian, and so I abide by the Christian faith. But actually being in that space, and you see this a lot in terms of prayer, meditation, all of that stuff. Like, it's very, very key for you in this season. And sheltering in place as well, it doesn't actually also mean don't step out of your house within your yard. You can go to the backyard. Research has linked the exposure to sunlight and the necessary vitamins that we get from sunlight to depression. And if you actually look at different parts of the world, and the depressions have been correlated with the level or amount of sunshine, depressions tend to increase during the winter times where we're not seeing a lot of sunshine. So please, shelter in place doesn't mean stay inside your house and lock yourself up and don't come out. Go outside, not like go outside in your backyard, or go outside around your, because and also try to make sure you open your windows periodically and get that fresh air in, because you don't want to keep circulating bad air within your home, the air outside, just so all of that. But I wanted to add those 2 points before you moved on.
And Barry, thank you for saying that. Someone commented here, and I know for myself, one of the things that's keeping me sane is daily. The first thing that I do when I get up is I go out for yoga. And so I go outside, and in Florida heat, 82 degrees at 10 o'clock in the morning, and I do my yoga. That's why I look so sun-kissed right now, just so y'all know. But I do yoga, I meditate, I pray, and I'll read a devotion as well. And so, and I do all of that outside, and that really grounds me and it uplifts me for that day. On those rare days that I don't, I'm really off being just inside of the house. And then the other thing that I do is in the evening, I go for a walk/jog, just depending on how I'm feeling, for 30 minutes, just to, get some exercise in, get my body moving, and just, get outside of those 4 walls. So just wanted to throw that in too.
So okay. I know that the time is run. I just wanted to add in that this is one of the most, for most people, most inhumane phenomena, right? To be able to be requested to contact or connect with other people. It is inhumane because we know that in hospitals, when babies are born, There was some babies that were given food but not necessarily held, and the other babies were given less food but they were held. And the ones that were held grew, and the ones that were fed a lot were beginning to not to thrive, because it is human to have contact, to reach out, to communicate with other people. And I think that you mentioned yoga as one of those things of inner communication. And I think Gina mentioned also about reaching out to other people. One of the things that we also can do, in addition to journaling, is to be able to reach out to other people through a positive word. So we have to put out in the universe that which we want to get back. So oftentimes we are in our own minds, and Jan Lebanzan says that we roam free in our head with no adult supervision, right? Sometimes we so busy inside of our space that we don't reach out. And so I found that when I'm in my most depressed, and as a psychologist, a clinician, I also have the moments of depression and sadness, that I reach out to someone else, and I may give them a positive word, and I send that to several other people, and I'm planting what it is that I desire to receive. But in reality, I'm just simply sharing something that I want somebody to know about how I feel about them. So in that right now, I'm going to share this. I'm going to plant this. I want to thank you, Nicole, for calling us to come together to have this conversation. That in the process of having this conversation, I have been lifted up and been more encouraged to do the work that I'm set here to have. A lot of stuff on this desk where I'm working with students. I've been getting texts and calls about registration, but this has been uplifting for me. So in the process of doing this and being who I've been called for to be, and you calling us to be, I've been so encouraged. I'm looking forward to getting up to New York and kicking it with Ben, when we can do more than just rub elbows. I'll find my way to Jacksonville for sure, North Carolina. And I am not afraid of the Bay Area. I've taught at San Francisco State University before, so I'll be there. And Oladele, I'll find you wherever you are.
I'm in New Haven, Connecticut.
Oh, well, I don't know about that. But anyway, that's a stretch. But no, I've been close by. I spent some time at Yale doing research. So I would just, I want to thank you, because this has been a healing moment for me.
I feel the same way. Thank you too. And I actually think you and Ben are fraternity brothers. So.
As long as he did that, we good, we cool.
Again, thank you so much from the bottom of my heart, panelists. Thank you, viewers. If you want to stay tuned, just a quick recap of what we've kind of discussed, and then we'll be off on our merry ways. So like Gina said, we will get through this. There's light at the end of the tunnel, self-love, and let's unite as a community. So these are some of the things that we addressed if you didn't join us at the beginning. So we talked about some of the chronic illnesses. So if you fall in these categories, then definitely take extra precaution with your health and some of the prevention measures. Some of the lifestyle changes that could help in order to mitigate some of the chronic illness, to prevent it, includes your exercises, how you eat, minimizing your bad foods. You know, our hottie toddies, we might have to, you know, limit those to one or two. And then weight was a big thing that was a factor as well. And then we talked about mental health and stress and how those managing those can help as well when it comes to avoiding chronic illness. Now, we also spoke about the impact of racism on health and well-being in the Black community, the lack of insurance, lack of access to quality healthcare providers, the disparity in treatment, even if you do have access. We talked about maternal mortality rates, complaints, symptoms being ignored, disparity in housing conditions, and what that does for us as far as being able to access good food, being able to safely exercise, the denial of the effects of racism and oppression on our mental health, which are inextricably linked to our physical health, and also the impact of mass incarceration on our community. Navigating the institutional racism, we talked about being selective about your physicians, and being consistent, not being hesitant to change, to try something different, building that trust, being able to talk to your doctor being honest with your doctor, being informed about your condition and your medications, and advocating for yourself, looking at employment opportunities with health benefits, and also advocating for loved ones when need be by attending doctor's appointments. And long-term, just having more Black people in health and medical spaces. For preventing the coronavirus infection, first and foremost, we want to think about immunity. So building your immunity. So what does that mean as far as how am I coming, what shape am I in when I come into this? Then also thinking about staying at home if you're able to, limiting your interactions to those who live within your house, social distancing measures, wearing a mask, and just frequent hand washing and disinfecting, and then responsibly using gloves, which isn't listed on here. Now, when we talk about immunity, here are some of the things that can help with immunity. And in conjunction to my conventional doctor, I also see a holistic healer. And this is some advice that she shared with me and some of her other clients. And so she highlighted some vitamins and minerals that should be present, some immune boosting foods, the importance of getting enough sun and enough rest, the positive effects of seaweed and sea seasonings, how important it is not to smoke anything, and she stressed anything, and to not drink coffee. I'm sorry for you coffee lovers. And then also she highlighted some spices that also help in boosting immunity. For essential workers, protecting themselves, we talked about asking the employer to provide personal protective equipment. I know the Governor Cuomo in New York put out an executive order requiring that from employers if they're going to have people coming into work with the gloves, the masks, the goggles, etc. Washing hands frequently, again, hand sanitizer, keeping the workspaces sanitized. And just recently I read an article where Lyft is offering free rides to essential and frontline workers. So that's something to look at in order to minimize exposure that you may get on public transportation. How do we help each other? So here are a number of things that we can do, but feeling a need and standing in a gap however we can, wherever we see that we can make a difference, be it we can sew a mask, we can donate hand sanitizer and disinfectant wipes, we can pick up groceries or deliver food, we can reach out to friends, have Zoom happy hours, connections. Also helping ourselves by loving ourselves, by caring for ourselves, and then having a strengths-based view of us as a people and our racial identity. If someone was to get be infected with COVID-19, some of the recommendations include to purchase a pulse oximeter, which measures the oxygen levels. And if the oxygen level drops below 94% when at rest or while walking, to go to the emergency department. Also the use of Tylenol and not your ibuprofen, avoiding elderberry and echinacea, and then drinking liquid, but not necessarily overdoing it. Dealing with trauma, we were giving the number for some hotlines. You'll find these numbers here for the National Domestic Violence Hotline, also for the National Suicide Prevention Hotline. Also, during this time, it's a good time to seek teletherapy. Before this, seek teletherapy, and now counselors outside of your state are able to treat as well. So if there's someone you know that does not live within your state, you can seek help from them. The Association of Black Psychologists has a website, and that website provides some resources as well. And then the Boris L. Henson Foundation is also paying for a limited number of sessions. And then a recommendation came from a good friend of mine, a recommendation on the book, Post-Traumatic Slave Syndrome. Now, that concludes part 1 of this 4-part series. And again, thank you for joining us. Part 1 is all about improving health and wellness in the Black community. I'd like to invite you to join us in the rest of the series. The next will be improving educational outcomes for Black students. And I'll give you a heads up on when that's going to come out. Part 3 is going to be moving internationally. So life for Black Americans outside of the US. So for those of you who are adventurous or you have an idea that you may want to try something different, then that part is going to be definitely geared for you. And then part number 4 is fighting the good fight and navigating the system here in the US. If you can or you won't leave at this time. So how do we navigate the system and how do we disrupt some of these inequities? So again, to all the viewers, I just want to say thank you. Thank you to our panelists and have a good rest of your Saturday and take care and stay